This Focus on Health segment is brought to you by Aurora Healthcare.
Hi everyone, I'm Connie Carmical and welcome to another edition of Focus on Health. Few patients have more unique healthcare needs than women, from preventative medicine to childbirth to menopause. It is important women get the right care at the right time and at the right place. Whatever stage of life you're in, you'll find a unique service here at Aurora Medical Center, Oshkosh. The service is called Midwifery. Midwives, and they do not just deliver babies anymore. In fact, it's becoming one of the fastest growing professions and a service of choice for many women. Joining me now is Jackie Pierce, one of the 4 midwives here at Aurora Medical Center. Jackie, thanks so much for joining us.
Thanks for asking me, Connie.
Well, we're here to talk about midwives, and that's your expertise. Why don't you tell us a little bit about, why don't we discuss some different types of midwives, including education and the types of practices?
Okay, I am a certified nurse midwife. I've been practicing for 8 years, received my master's degree at Marquette University. Prior to that, I had a bachelor's degree in nursing and worked a lot of labor and delivery, and that's what got me into the whole midwifery group. Typical women will traditionally begin as a bachelor's, work as a labor and delivery nurse, and then go right into their master's degree. We've seen a big change happen within the past 5 years where not necessarily are they nurses anymore. They may be professional, they may have been a social worker or something like that and decided, I want to get into midwifery. So they get into the schooling and they receive their master's degree, but they're not a nurse midwife, they're a professional midwife. That's a big change for the state and nationally.
How exciting. Well, besides delivering babies, because that's what everyone thinks of when they think of midwives, besides delivering babies, how else do midwives take care of women?
Well, usually when we first have our encounters with our women is when they're pregnant. Following pregnancy, we'll see them for their postpartums, and then when they decide that they need annual exams, they'll go right back to the midwives because they know us, they've been the most comfortable with us. So we may start seeing somebody in her early 20s, progress to the 30s, 40s, 50s, word of mouth gets around, and pretty soon we have all ages. So we typically concentrate with obstetrics. As she goes through her aging cycle, we do all the typical screening preventive things that we normally would do as an OBGYN or even your family practice doctors.
Tell us what the day-to-day entails with the midwifery clinic.
Okay, our midwifery clinic, we have 4 midwives that practice together along with 6 OBGYNs, so it's a very busy clinic here at Aurora. We will typically start our day, depending on if you're on call or not. You may start as early as 7 in the morning, jumping right into a woman that's been in labor during nighttime. If you're on call, you may start to do some postpartum rounds, and you may have 1 patient to 4 or 5 patients that you're rounding on, seeing how she's doing or possibly discharging her. Women that breastfeed, we will definitely see her within 1 to 2 days afterwards for a breastfeeding visit. From there, we go right over to the clinic and we start our days seeing maybe routine OBs, or we will go right into physicals. We do a lot of problem shooting where women may have questions regarding infertility. That's pretty typical of a day. A day can last from 7 in the morning till 7 the next day.
Oh my
Just
goodness.
depends on how many babies are being born.
Well, I'm just curious. I would think that after you try this one time, and if you want more children, that you would do this over and over again. Do you find that with different patients?
Typically, once we see somebody and deliver their baby, whether it was a midwife here at Oshkosh and Aurora, or maybe somebody from Kalamazoo, Michigan, they will seek out midwifery care, and they'll find another practice and they will come back. As far as delivering babies, I have many patients that we've delivered numerous children, and the children come in for the visits. They learn to help do Doppling and measure the mom, and it's family involved.
Oh, that's great. That's wonderful. So Jackie, can you tell us how this has changed over the years?
Over the years, when we first started, traditional midwives had done deliveries at home. We have progressed through the decades and now delivery only at our hospital here at Aurora. We have watched changes within the birthing suites, from labor beds to utilizing labor balls. We have a beautiful jacuzzi that somebody can go into and soak the whole labor if she wants to. She'll get into the tub and come out and deliver her baby in bed. If she chooses, she may stand with a lot of blankets around her. It's her choosing, and we do a lot of that planning prior to the actual birth, where they work on birth plans. So the midwives, the group of us, knows what the woman wants and can follow her wishes as long as it's safe and we're still monitoring and taking care of the baby at the same time.
That's wonderful. I mean, you really do make everyone feel comfortable, not only the patient, but the family and everyone involved.
And I think because we know our patients so well, we see them through their prenatal care, that we're very comfortable with them and their wishes also.
Oh, that's great. That's great. Well, if any of our viewers or listeners out there would like more information, maybe they don't know the first thing about midwives and they want to take this route, what should they do?
They should contact our midwives here at Aurora, 303-8700.
Okay.
If she likes to go onto the internet, she may go to the Aurora website and go under Find a Doctor, and all 4 of the midwives are listed.
Okay, great. And if you want more information, that website is aurorahealthcare.org, or you can call the office at 303-8700. Jackie, thanks so much for joining us.
Thank you.
We are now here with Kimberly Van Sistine. Kimberly, thanks so much for joining us.
You're welcome. Thank you.
Well, I understand that you are one of Jackie's patients, and you've done this about 3 times already.
Yes.
Why don't you tell us a little bit about your experience?
Well, when we first decided, when we had our oldest daughter, Olivia, 5 years ago, I had actually been seeing an OBGYN and just felt that the experience was not quite right. I had always been so excited to have babies, and the day finally came, and I just felt like there wasn't that connection there. This was just something really important to me. Children are just such a gift, and then I just started to ask more people about midwives, and I heard a lot of people say, well, a midwife is there to hold your hand, and I thought, well, what does that really mean? So I actually called the clinic, and I got a hold of Jackie, and just thought, well, I'm going to come in, and I didn't really know at that time. I thought, well, maybe I should still see the OBGYN. You know, I thought that's a doctor, and they know what they're talking about. So I came to see Jackie and just fell in love with her instantly. It was such a bond, and they really care about you, and they care about the baby, and just found that when you go to your regular doctor visit, sometimes you're just there for 10 minutes, and they just say, okay, this is your blood pressure, you know, this is what we check, and you go home. And I just kind of would leave feeling a little empty. But then when I started to come here and I would see Jackie, she just truly asked how you were doing and how the baby was doing, and they would open the book and say, you know, at this stage of the pregnancy, this is what's going on, and this is what your baby is doing inside you, and it's growing, and these are important things to do, and just the different things involved with your health, like the different vitamins that you can take, and foods that are really good for you to eat. That was really important to me. I just didn't want it to be an in and out kind of visit. I wanted that, you know, more of a bond, the hand holding, I guess.
Sure. Well, it sounds like they made you feel very comfortable.
They did, yes.
And would you recommend this to other people then?
Absolutely. Okay. I hear so many horror stories from moms about the experience, and most times they may not even see their doctor when they actually go to deliver, or the doctor kind of rushes in for the last 10 minutes. But with my firstborn, with Olivia, I was in labor for quite some time, not just a 10-minute in and out. And Jackie was there with, she had the ball that I could sit on the ball to make me comfortable, and she gave me a massage, and she had me pick out my own massage oils, and my husband loved it because all he had to do was hold my hand, and she was there just making sure that I was really comfortable the entire time, not just the time that I was actually delivering the baby, but from the beginning all the way to the end.
Well, that's great. So they give you, this is another option.
Mm-hmm.
Okay,
yes.
Great. All right, well, thank you so much for joining us.
Yes, thank you.
So there's another option for women seeking someone to help deliver their baby. A medical professional to help them through all stages of their lives. If you'd like more information on midwives, you can always call the Aurora Health Center at 303-8700. You can always log on to the Aurora website at aurorahealthcare.org. I'm Connie Carmical, and thanks for joining us on this Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.